Sairam, welcome all of you to April edition of our Regional Inspirational channel. Today, we'll be talking about one of the service activities which our region people has done. And as Swami has mentioned again and again, service happens to be the very first stepping stone to realize Him. And some people say, okay, well, devotion is also part of the service because you'll be doing bhajans or rituals and all those things. But any service activity with an intention of helping others selflessly is a stepping stone for reaching God. With this brief introduction, I would like to talk about the service activity which we are going to introduce and share by our region service coordinators. This is about COVID-related activities. Now, I request a regional service coordinator, Shiva, to come and introduce the panelists. This particular activity is going to be a panel discussion about various activities each center has done by that center representatives. So they would come and share what that center has done in helping to reduce, alleviate the problems of the COVID. Shiva, please, sign up.
Sairama, would like to start this presentation invoking Swami and with his divine message.
Why are we born? The life birth is not for food, raiment, and shelter, for eating and drinking. No.
The best way to love God is to love all, serve all.
The best way to love God is to love all and serve all.
మనం అందరినీ ప్రేమించాలి.
We should love all.
అందరినీ సేవించాలి.
We should serve all.
సేవే మనకు ప్రధానమైన కర్తవ్యం.
Service is our duty.
కానీ ఈ డ్యూటీ ఆ డ్యూటీని గవర్నమెంట్ డ్యూటీస్ కాదు మనకు.
It's not official duty or government duty.
తోటి మానవులను సేవించి
we should serve all.
తోటి మానవులను ఆనందపరిచి
we should make brethren happy.
తోటి మానవులను సుఖపెట్టడమే మన కర్తవ్యం.
Our duty lies in making our brethren happy.
కనుకనే మొట్టమొదట మనము సర్వీస్ లో ప్రయాణం కావాలి.
First we should take the path of service.
ఈ సర్వీస్ లో మనం ప్రయాణమైనప్పుడే మానవత్వం అనేటువంటిది సార్థకం అవుతుంది.
When once we take this journey of service, our life would be redeemed.
Highest sadhana is to transform love into service.
The highest form of sadhana is to transform love into service.
కనుక
so
మొట్టమొదటి సేవలో మీరు ప్రారంభించి
start with service.
నేను అనేటువంటి స్థానం నుంచి మనము అనేటువంటి స్థానానికి మీరు చేరండి.
We should start our journey from the point of I.
అది ఎట్లా చేరేది నేను చెప్తాను.
Bhagavan will tell us in due course of time.
కనుక
so
మొట్టమొదటి మీకు ఈ ప్రాప్తి చిక్కింది.
లోకంలో
ఎంతో మంది ఉంటున్నారు, లక్షల మంది ఉంటున్నారు, కానీ ఆ ప్రాప్తి మీకు మాత్రమే లభించింది.
There are countless number of people outside world. You are really fortunate to be here.
ఈ లభించినటువంటి యొక్క అవకాశంతో సద్వినియోగపరచండి.
Make use of this fortune, good luck conferred.
దానిని మీరు 10 మందికి పంచండి.
And share this joy with everybody.
జగత్తుని సేవించండి.
Serve the whole world.
మనం ఈ ప్రపంచంలో పుట్టింది సేవ కోసం పుట్టాము, కానీ అధికారం కోసం పుట్టలేదు.
We are born in this world to serve, not for authority.
ఈ అథారిటీ ఏమిటి? అథారిటీ
What is this authority?
మనం సేవించడం కోసమే పుట్టాము.
In fact, we are born to serve.
భగవంతుడు పుట్టించిందేనంతా కూడా సేవ కోసమే పుట్టించాడు.
In fact, God's creation is for service.
కనుక సర్వీస్ కోసమనే మనం పుట్టామనే సత్యాన్ని గుర్తించాలి.
Understand the truth that we are born to serve.
సర్వీస్ అంటే గవర్నమెంట్ సర్వీస్, ఈ సర్వీస్, ఆ సర్వీస్, ఈ సర్వీస్ కాదు.
It's not government service.
ఆ సర్వీస్ ఏమైనా మీరు చేసుకోండి.
You can serve it that way.
విశ్వ సర్వీసు మానవ సర్వీసే మన సర్వీస్.
And the real service is serving the humanity, human service.
బీదలను ఆదుకోండి.
And help the poor and poor.
రోగులను మీరు ఎంతైనా ఉపకారం చేయండి.
And help the sick.
శక్తిహీనులైనటువంటి వారికి శక్తిని అందించండి.
And help those who are weak.
ఊరికి సంపాదించుకొని మన పొట్టలు నింపుకోవడం కోసం కాదు.
To earn and amass wealth and just go by that money.
బయట కూడా పొట్టలు ఉన్నటువంటి వాళ్ళు కోట్ల మంది ఉన్నారనేటువంటి సత్యాన్ని గుర్తించాలి.
Understand that many poor and needy people outside.
ఎన్ని బాధలు పడుతుంటారు.
There are many suffering people.
అలాంటి దాన్ని మనం ఆదుకోవడానికి తగిన
We should go to the rescue.
అప్పుడే మనం తగినటువంటి యొక్క సార్థక జీవితాన్ని పొందిన వాళ్ళం
Then
అవుతాం.
only we will build the
ఆధ్యాత్మికం అంటే ఏమిటి? అది స్పెషల్ గా ఉండేటువంటిది కాదు.
spirituality is not a special field.
నిత్య జీవితం లోపల అది మనకు వే ఆఫ్ లైఫ్.
Spirituality is a way of life.
మనం ప్రత్యేకించినటువంటిది కాదు.
It's not separate from our life.
మనం ఒక డిగ్రీ తీసుకోవాలంటే కొంత సబ్జెక్ట్ తీసుకోవాలి.
In fact, to get a degree, you should
కానీ
study one
దీనికి ఏ
subject.
సబ్జెక్ట్ లేదు.
But there's no subject here.
సబ్జెక్ట్ ఒకటే ఒకటి. లవ్ ఈజ్ బెస్ట్ సబ్జెక్ట్.
In spirituality, there's only one subject, the subject of love.
ఈ లవ్ ని మనం పెంచుకుంటే అన్ని సబ్జెక్టులు దాంట్లో లీనమైపోతాయి.
Then once you develop love, all other subjects will follow.
కనుక ప్రేమ స్వరూపమైన మీరు ప్రేమను పెంచుకోండి.
You're the embodiments of love.
సర్వీస్ ని పెంచుకోండి.
Serve people.
అప్పుడే అన్ని విధాల మీద సార్థకం అవుతుంది.
Then you'll be successful.
So, as Swami has said, we have taken the main theme for the service wing from Swami's July 2002 speech. He said that love more and more people, love them more and more intensely, transform the love into service, transform the service into worship. That is the highest spiritual practice. So, as Swami has also talked about, service is for self-transformation. In other discourses, he has mentioned the difference between seva and service. He always used to say seva is selfless service without any expectation. And I would like to thank all the people, all the devotees who have done this selfless service, seva, during this pandemic. Now, I would like to introduce the panelists for today. Sister Soumya, Dr. Soumya Paspaleti. Okay. She's a member of the Austin Sai Center since 2006, participated in several medical camps in our region, and she's currently serving as young adult female advisor for the Austin Sai Center. Sister Soumya.
Saira.
Okay, the next speaker is our brother Ram Prasad. He was introduced to Swami at young age. He's been active in the Southeastern Sai Center since 2012. He served as young adult rep and also as vice president. He was very fortunate to work on the Juvenile Detention Center Seva, which most of us know, and is currently serving as a president of the South Houston Sai Center. The Ram Prasad. Okay, the next panelist is Sister Swati Chilkuri. She's alumni of Satsai Primary School at Puttaparthi. She's been active of the Austin Sai Center since 2008. She served as the president and devotional coordinator for the Austin Satsai Center, and she is currently working as Satsai Spiritual Education Teacher, SSC teacher.
Saira.
And then the next speaker is Sister Supriya Karod. She heard about Swami when she was 10 years old. She served as a young adults women's coordinator for the Dallas Sai Center. And she also served as SSC coordinator for Austin Sai Center. She's currently teaching Group 4 SSC students in Austin Sai Center.
Sairam.
Our next panelist is Sister Vijayashri Venkatraman. She is a member of the Dallas Psi Center for over 32 years. And she's been teaching Group 4 SSC for more than 10 years now.
Sai Ram, everyone.
Sai Ram. We also have two videos that we'll be presenting. One is by Sister Dhara Patel. She's a young adult. She participated in the SSC Psi Center of Dallas from her age of 5 to 18. And she's currently a young adult from Dallas Psi Center. We also have a SSC student, Sai Shankaran. He participated in SSC from Pre-Bal Vikas. He's interested in nursing home seva and also singing bhajans. He's currently the Group 2 SSC student from South Houston Psi Center. Now I would like to briefly mention the different services that we have done related to COVID since the pandemic has started. We classified them into in-reach and outreach services. For the in-reach service part, we have done like member well-being checks, help hotlines, health and safety education, grocery and medicine pickup for elders, and also programs for spiritual upliftment. As far as the outreach services are concerned, we have done the PPE preparation and delivery, our cards for community heroes by the spiritual education SSC students and parents, food preparation and distribution, and also Vaccination Angels. Let's start our journey from the PPE preparation and delivery. Since the start of the pandemic last year, many PPEs have been made, purchased, and delivered to several people in need. The first question is to Sister Vijayashri Venkatraman. Sister Vijayashri, could you please share your story on how you contributed to start the face mask service activity?
Yes, I will. Sai Ram again. Last year, when my daughter had completed her Sathya Sai International Leadership Program, at the culmination of that, she had wanted to do a community health project. And right around that time was when we heard about COVID, and quickly it became a pandemic. And we started seeing in the news about how there was a severe shortage of personal protective equipment for the physicians and the other healthcare workers in New York. So she and I went to some of the nail salons and other places nearby and got some of their disposable masks as well as disposable gloves, because they were closing their businesses due to the pandemic. And so we got their donated material and we shipped that to New York. But we found that it was cost of shipping was prohibitive at that time. And then we tried to buy more of the masks and they were in short supply. We couldn't buy them and price gouging was happening and so on. So we were brainstorming about if there was a sustainable way to make reusable masks. And we approached our center president. Around the same time, some of our Sai sisters in our center who had skills to stitch and make cloth masks, they had also approached the president. And so quickly we formed a team. A local business in Plano, Texas, where our Sai Center is located, called Stitch House, gave us pre-cut material with instructions for how to make the masks. And so we picked up the material from them and we started making them. This was initially a very small group of ladies who already knew how to stitch. But more and more of our members, including myself, who has no knowledge of how to stitch, wanted to participate and wanted to contribute. So around this time, we found that SSIO came up with guidelines about how to make, what material to use, what interface to use, whether it need to be 3-layer, 2-layer, whether with pockets and so on. So they gave us some guidelines. So with the guidelines provided, we understood that there were several roles possible, not just ladies who knew how to stitch. There was a whole assembly line, starting with material to be sourced, which was in short supply, by the way, because the whole world was trying to make cloth masks. Recommendation from SSIO was to make 100% cotton, breathable material to make. So to find the material at an affordable price, elastic material, interface material, and if elastic was not available, some alternatives like ties and so on. So all of this needed to be sourced. Then it needed to be distributed. Like in Dallas, it's a large, Dallas-Fort Worth, as you know, is a large metroplex. And these ladies who were willing to stitch were all in different zip codes, sometimes 20, 30 miles away from each other. So we needed to have runners to go and give them the material, the raw material, and when they were finished, to bring them back. Even before giving the raw material, after it was sourced, it needed to be washed, ironed, and pre-cut, because we bought material in bulk, 20, 30 yards at a time. So then it needs to be washed, ironed, cut, and so on. So the men folk, the little children, elementary school age children, all the way up to grandmas and grandpas at home, everybody helped. So soon it became like a family project. Everybody got involved. And when other people who were not even part of the Sai Center, who were our friends, saw that what we were doing, they asked to get involved. So soon, from a handful of people, it grew to about 60 people for the project. Those who were cutting, those who were washing and ironing, those who were making the masks, those who were collecting and bringing them back, and those who were washing the masks and pressing them. And then they needed to be shipped around the country. Our center, we actually shipped to 6 different states, multiple different facilities, be it healthcare facilities, doctor's offices, nursing homes, our service partners like Austin Street Shelter for the Homeless or the Salvation Army. So all these different places that we were distributing to, and if they needed to be shipped overseas, to out of state, based on, we took your request from this regional service coordinator to our center coordinator, and then we made sure that we would ship them in a timely manner. We made use of one of our members' employee discount for shipping, so it could be shipped expeditiously, but also in a discounted way. And so everything was happening sort of like in a workplace. In manufacturing facilities, we would set up like a workflow. Similarly, we had like a workflow and we worked together. And Swami made it so beautiful for all of us to take part and touch so many lives. So many thousands of these were made week after week after week. In fact, all these women were recreational sewing abilities, right? They were not like professional seamstresses, and they had machines which were sometimes like decades old. They did not have the latest and the greatest sewing machines. So sometimes these machines broke down. So some of our Sai brothers came in, they found the parts, and then they came and helped to fix those machines. And when we did not have, when we ran out of thread and we bought like industrial size thread, one of our Sai sisters made DIY, do-it-yourself kind of a spool to feed the thread and so on. So in this way, everybody worked so harmoniously, and several thousand masks were made. And we thanked Swami for making us his instruments to help these people.
Thank you. Now I would like the next question to Sister Dr. Soumya. So Dr. Soumya, how did the national team produce guidelines on stitching masks? Any inspirations or insights?
Right. Again, I'm filling in today for Dr. Lakshmi Atkuri, and she's our regional medical director. Once the SSIO of US team recognized that we needed more face masks and we are short of it, they came up with a team and formed these guidelines. And the guidelines was like the fabric, what kind of fabric they have to use. They have to, some of them are woven, some of them non-woven fabric, double layered, and everything has to be according to the CDC state or local guidelines. So we had to follow those guidelines. And as Sister Vijayashree said, it was double layered. It had to be washed, disinfected before they cut. The area had to be very clean and sterile, the homes, and what kind of strings they would use, all that kind of thing, and not use any kind of filters in there. So these were some of the guidelines. And according to those guidelines, as our sister said, the distribution happened throughout the center and all the members made it. And our inspiration is, of course, our Swami, and his love for all of us keeps us together and do the activities. And our Sai sisters and brothers have worked really hard. And most of them at this point had a lot of work at home, taking care of kids, their own work to do, but they put a lot of work at late night to make these masks happen for us. And service is not new for any of the Sai families. And it was really humbling to see everybody come together to make this community a great place, and even with their struggles at their homes. And as she said, some of them helped by bringing the fabric. Some people helped with the collaborating with the community, with the nursing homes, and finally the distribution. So we are really grateful for Swami for giving us such a wonderful Sai family, and who can always help whenever there is a need. Thank you.
Thank you, Dr. Soumya. Now, I would like Sister Swati to, Sister Swati, could you please share on how the activity expanded in the community and how did the community benefit from it?
Hi, Ram. We're just grateful, I think, Swami, for giving the opportunity to see his love, not just within the center, but from everyone in the community also. So in March 2020 was when Dr. Charita first approached to find out how we could help make masks, because she saw the urgent need in the medical professionals because they were not able to get masks. They were running short. In Austin, we're very fortunate to have a strong Sai Sister WhatsApp group, and it has been active for many years now. And any help I've needed, I've just posted and got good response from everyone. So with that already in place, I posted a request for help for making masks in the Sai Sisters group. And then in 2019, December, I was added to our community group, which I was not really active in. And since I had not initiated the request, I took it as Swami's wish for me to join the community group. And I was like, I joined it and I was pretty inactive. But then when this request came, Swami made me kind of post that request even there. And I sent out a request for help. And this was, again, another group of sisters who immediately kind of responded. There was such overwhelming response from them. They said, okay, you tell us what help is needed, we will help. So we created a separate WhatsApp group so we could kind of communicate with whoever was interested. So we called it Sisters of Austin Love Sewing. We shared the group link with Sai Sisters and the community groups. And we said it was open for anyone to join. they could share it with their friends and family. So the group just grew based on people's interest. It started slow, but then within a week, we had a lot of people who joined. There was, initially we had, at that point, SSIO guidelines had not come out. So we were still kind of figuring out what type of masks to make. So, and thankfully we had doctors in our group. So we initially had a few Zoom calls to finalize what design to use to create the masks. And with the help of experienced sewing people and with the doctors, we could kind of, they did a lot of research, found which design would work and which would be simple enough for any new beginner to start. And the doctors helped us figure out that 100% cotton. And then of course, SSIO guidelines came out, and then we were like glad that we had kind of, the design that we had picked was similar to theirs. So it was kind of easy to move on. And initially there was a lot of hassle about what days we would drop off. It was almost every day, few people would drop off masks, we're trying to collect. But then having that once a week Zoom call to decide and streamline the process kind of helped. So we picked Tuesday, Thursday, we would have everyone drop, finish making the masks, bundle it up, and make sure they count how many there are. What type of masks? Are they masks with filters? Masks, masks with pockets for filters, or masks without pockets for filters. Masks that had, I guess, a place for putting the nose strip, masks with nose strips. So, and everyone was so diligent in kind of packaging. They would pack, say, even if it was 10 masks, they would say 10 masks made, and they would put it what type. And some of them made hundreds, and that groups kind of made them together. And also we had any new person join. It wasn't like I had to answer, or there was like a group which said, okay, these are the experts who can answer. Anyone in the group would kind of pick up questions and they would answer them. And it was just a self-organized group. There was no lead, or no one waited for anyone to answer. Anyone available would answer the questions. It was just, the whole process, it just made me see Swami's love flow through all these people. It was very inspirational. And anytime we saw a need, we would get the request from the service coordinators. I mean, whether it was Austin State Hospital, or the doctors would tell us about nursing homes. And then we had the volunteers also kind of find nursing homes or any of their friends, doctors, or anyone who needed. They would say, can we have some masks? And the only guideline we had was the disclaimer, and we'd make sure that the disclaimer was signed, and then we would send out the masks. There was no question asked where the request comes from. And it wasn't just people who actually did new sewing who were part of this. There was a group of people who drove. They said, we can drive, so the people who are sewing don't have to be on the road. They would go pick up materials, drop it off. There was a group of people who wanted to fund. So they would order the materials and set it up for curbside pickup. The drivers would go pick it up and drop it off at whichever volunteer needed the material. There were few young adults who signed up to say, once the masks are ready, we will go drop it off at the location that needs it. And they would promptly come on Tuesday, Thursday, come pick it up, and then go drop it off. And there were some volunteers, they probably don't consider themselves as volunteers, but they did so much help finding the places where there was a need. They would tell us, okay, like for example, someone would go on Facebook and see a post. One of the examples is the Navajo Nation Chinle group. They saw a post from Chinle group saying they needed masks. They reached out and they said, do you think we can help them? It is not in Austin, it is out of state, but looks like there's a big need in Arizona right now and they need masks. We reached out to Brother Shiva and he said, sure, let's, and all over the region, it wasn't just Austin Center or, first of all, it wasn't just an Austin Psi Center thing. It was just the Austin community. There were people, a lot of people who were outside the center also who helped. everyone from the region helped make masks for Chinle, and we mailed it to them. And then at the same time, there was this other request that actually it wasn't even a request. This uncle, he was watching news and he saw on the news a program about farmers and how they have, he felt that in all this COVID pandemic, we had forgotten about the farmers. He said we were giving thanks to the medical professionals, we were doing everything, but the people who were providing food to us, who were working throughout, we had forgotten them. And he was actually feeling bad that he was not able to do anything. But that information that he provided, that helped us to kind of contact, do a search, and we found out about masks for farmers. And we were able to find that, yes, they needed masks, and they provided us all these contacts of all the different places, not just in Texas, California, Connecticut, Florida, wherever the farmers were at that time working. And they would say, can you send these? And instead of it becoming a region-wide effort, it became a national effort where it wasn't just Austin Center or Region 10, it was regions across the country who kind of pulled in and were sending masks. So I know this effort was definitely not just sewing people or people driving. It was also indirectly anyone sitting at home who helped out. And I was very fortunate to see the love of all the people. And my circle was very limited. Like I think Swami's discourse, he said, like we start from I to we. And he just made me kind of grow from just being from myself to Sai Center or people in the community to nationwide. So I'm just glad that Swami made me see his love in action. So thank you.
Thank you, Sister Swati. So this was the college of all the community people coming together. Pictures, you might have already seen this also. We have, as all the panelists have described, we have provided masks to nursing homes, clinics, medical centers, food banks, Salvation Army, frontline workers, homeless people, farm workers, farmers, and also women organizations. And we have provided masks to Region 2, Region 5, Region 7, Region 9, and all the 4 states in our Region 10, Texas, Louisiana, Oklahoma, and Arkansas. We have not only made face masks, but also scrub caps, gowns, and ear savers as well. Now let's move on to face shields. The 3 methods which we acquired the face shields. One was made by our young adults and Sai brothers with and without the 3D printer's help as well. Then other groups supplied these by the company called Applied Materials and distributed it directly to the needy facility. And also we procured from a reliable vendor and then we distributed it to the needy facilities. Yeah, now I would like to play a small video by Brother Sai Shankaran on his experience of preparing a face shield.
Salam everyone. My name is Sai Shankaran and I am from the South Houston Sai Center. I helped make around 50 face shields for my community. It started out when my mom got a text from the Seva coordinator to see if we were interested. My parents thought I should do it as a service, so I took it up. It was summer at this time, and I really didn't have anything to do, so I learned how to make them with help from my mom and made around 15 for the first batch. My mom delivered them to another devotee's house, and they asked if I wanted to do more. The second batch had around 35, and it was much, much easier because I didn't need to look at the measurements, and I didn't need help to cut the pool noodles and elastic bands. Seeing that I was bored and had nothing to do, I'm glad I did something productive and useful for the doctors and frontline workers. From this opportunity, I learned that whenever you have free time, you should use it productively to help others. And since it was COVID time, I could not participate in Seva in person, so this was an opportunity for me to do Seva. Thank you, and Sairam.
Awesome.
Sairam, everyone. My name is Sai Sam.
I would now request Brother Ram Prasad to please share what inspired you to create and distribute face shields.
Sorry, muted. Sure, brother Sairam. As our student Sai Shankaran outlined, this activity of making face shields came at a very opportune time when many of us didn't have much to do. We were all quarantined and isolated. And so my thoughts are along the same vein. I found myself in the midst of my wife and my mother-in-law busy making face masks, as other sisters had mentioned. And they were making a lot of face masks. And I, for one, was not very gifted in the art of sewing. And so I found myself helping on the periphery, cutting elastic bands and cutting. So there was this little bit of a longing to be able to use skills that are more closer to me. And right around that time is when our service coordinator, Sister Sridevi, shared this text saying from a national SSIO, there is a requirement for face shields. And there was some video with some couple of methods on how these face shields could be made. And quickly it sparked my interest, and I felt I was able to relate to it. And I felt that this is something that I can do. And I was able to read up on it. And then I made a visit to the hardware store to find materials that were somewhat closer to what were outlined. So we came back and we put together some face shields, and then we gave it to an initial set of volunteers to try on. You know, we knew that these face shields could be worn for a few hours at a time, and so we wanted to make sure that they were the right length. You know, they did not obstruct the head movements. They were safe, that the staples did not scratch the skin, and the elastic bands were, the right tension and everything. And so after the initial set of volunteers tried it out and gave us assurance that it was safe, and so we got some good feedback. And then we wrote up some instructions. I enjoyed the process of writing instructions because we knew that, a lot of our Sai family would be engaged with this instructions. So then once instructions were done, we put together kits, kits of elastic bands and transparencies, and so we could distribute. So once kits were done and they were quickly distributed, and what we did not see coming was how this activity was easily taken up by a large number of SSC children. These face shields were not too difficult to make. They were, using the same kind of skills that they learned in school, cutting and stapling. And so quickly this became a very family-oriented activity that people could do at a time of isolation. A lot of families picked it up, and then we would get calls and, hey, do you have more kits that we would like to do? This is actually quite interesting for us to do. And sooner and later, a lot of families got involved, and suddenly we are now left with a large number of face shields. And that's when we stepped into the distribution phase, right? And the distribution phase provided us a great opportunity to engage our community at large. We had no idea at that time where all these face shields would end up and how they would make an impact. These face shields were used in our local police department. They were used by the EMS staff who were attending to COVID patients on the field. Face shields were distributed to the entire Texas Medical Center complex, which is the large complex of hospitals in the Houston area. They went as far as Montefiore Hospital in New York, I'm being told. And there is this a nice incident about an art camp, for kids that was about to be canceled because they could not find PPE. And once we heard about it, and as a service coordinator provided those face shields, made it available to them, and they were able to hold the art camp, and a lot of kids actually were able to go ahead and do their activities. I thought that was a really interesting. And another interesting story is how some of the staff at the hospital in where our service coordinator worked, suddenly found themselves one day without the professional face shields that they were all using. At that time, New York was the epicenter of the COVID pandemic, and suddenly one day they had diverted all the equipment or the PPEs to that facility, to that region. And the staff were encountered with this dilemma of having to draw blood and work with the COVID positive patients, yet without protective shields. And luckily she had those shields in her car, and the moment she handed them out, and they were so grateful, and so apparently they had tears in their eyes about the thoughtfulness of the gesture. And no one was able to see the amount of impact that we were able to make, not the people who made it, and how the timeliness of how we made these face shields made all the difference, right? And so in hindsight, when thinking about it, Swami created the interest in one set of people, sparked the interest in one set of people who were interested in making the face shields, then moved that activity to a group of families and kids who were really engaged with making that activity at a time when there was not much to do. And then with those face shields, and by making those available at a time when there was a dearth, when there was a lack of this protective equipment, we were able to make a meaningful and loving impact in the lives of so many people. In a similar way, our Sai sisters, in Houston, were able to make beautiful handbags, beautiful, shawls in appreciation of all the frontline staff. From reused, silk saris. These things, the face shields and the silk saris, the shawls, made a meaningful and loving impact in the lives of so many people. And in reflecting upon this, the biggest inspiration that I take away is this experience, is the attitude of serving as an instrument that Swami has instilled on us. By ourselves, we are not able to see how we serve, but Swami strings us together in all these beautiful ways to bring about, orchestrate something that is much greater than each of us could have imagined. And so by realizing that fact, we feel that we are loved. We feel Swami is using us as his instrument, and we cherish that love. And that is the attitude I think, myself and many of us who are involved in this activity took away. And that is the inspiration. With that, I'd like to end. Sairam.
Thank you, Ben. So like our brother has mentioned, apart from the face masks and face shields, we also have done several other things. We have acquired and shipped 4,500 KN95 masks to all the regions in US, and we also distributed to many facilities within our region. And several hand sanitizers, gloves, and other medical needs were also distributed to the needy. So as a summary of most of the items that we have done, handmade face masks, we have done about 17,830, disposable face masks, 6,000, gloves, about 4,300, face shields, about 3,404, KN95 masks, about 4,500, hand sanitizers, 800, handmade gowns, 744, scrub caps, 387, and ear savers, about 57. And our act of love was reciprocated with letters of gratitude from the recipients. So many letters, so many heartfelt thanks, notes, and all. Just captured a few of them here. Now I would like to move a little bit to the hot meal service that we have done. The national team has guided us on to do the hot lunch distribution. So we have started the hot lunch distribution to homeless shelters. And also several people have donated packed foods to food banks and pantries. So like you have seen here, more than 50 volunteers prepared and delivered more than 300 meals each week. And as you see, several centers like Austin, Dallas, Southeastern, Northeastern, Longview, and Little Rock, Arkansas have provided hot meals. San Antonio and Oklahoma stood out because they have prepared and distributed meals every week. They have gone, in spite of the pandemic, they have took all the precautions and have prepared in a soup kitchen or similar facility with all the precautions and have distributed hot meals. While San Antonio has distributed it to St. Vinny's Bistro, Oklahoma has done it for the homeless people every week, about 50 people. Now, let's move on to the next topic, vaccination angels. Who are vaccination angels? They are the one who help elders with online registration for vaccine appointments and also provided transportation to the vaccination sites for the needy. Now, the next question I would like to request Sister Supriya to please share what inspired you to do this Vaccination Angels service.
Sairam, thank you, Shiva. Actually, when I jumped into this, I had not heard of this term Vaccination Angels. So the way I got into it personally was I was inspired by a friend of mine. She has 80-year-old parents who live with her. And there was only one place in Austin, the Austin Public Health location, where they were registering people to get vaccines. Now, the problem was that it was an online registration, but there was always uncertainty as far as when appointments were going to open up. It could be any day of the week, any time of the day, and as soon as they opened, it was like this mad dash to grab these finite number of appointments that were open. So, and also what was happening is when you were filling the online form, at the end of the form, sometimes it would say, your entry hasn't registered properly, etc., click again. And, it would give this kind of message. So what happened is a lot of the elderly people were thinking they made some mistake. So they would try to start the registration process all from the beginning. And already there's many elderly people who are not very comfortable using these kind of online portals to register and stuff. So what my friend started doing is she created a WhatsApp group to at least let people know when the portal was going to open. So one WhatsApp group actually ended up being 6 WhatsApp groups because there were so many people who wanted to know. And the service that she was doing was she was monitoring the portals and letting people know they're open. So once the portals were open, then the second part was to help get people registered. And she was helping with that too. And so I heard about all of this and I felt that, you know what, maybe let me see where and how I can help. And it was almost like we were creating a chain. Like she was the link in the chain here. And then I just came and I hooked myself onto that chain. And I reached out to my various groups. I reached out to my watercolor group. I reached out to my school group, my neighborhood group, and I put it on Sai Sisters, on our Center Sai Sisters group. And basically just saying that, hey, if any of you are in groups 1A or 1B and you need some help registering for vaccines, please let me know. That's it. So from the watercolor group, I had some people contacted me and they said that, yes, can you please help us? And what happened is some of the people, I just let them know when the portal opened. They were able to go there and register themselves. Other people had to actually get on the phone with them and manually register them as they told me information. Now, what happened is the beauty of this is I put this on Sai Sisters group. I didn't ask for help or anything. I just said that if anyone needs to register, let me know. But then there were quite a few people who contacted me and said, hey, you know what? Let me also see, can I help people register? Can I help you with what you're doing? So now what happened is all these people, they joined on as another link in the chain. And then Swati was actually one of those people. She was busy sewing masks, but she was also helping sign up people for appointments. And so in that way, also some of the people who I had helped with the watercolor group, they contacted me and they said, hey, I have this other friend. Can I give her your contact and can I help them? So now we're just creating this chain, kind of like what Prasad was talking about earlier. And so in the volunteers who kind of jumped in at the center level, they also did the same thing. They talked to people on the phone, they were helping register people. And, just in this way, we were able to register quite a few people. And what happened is then as, we fulfilled these registrations, then people, unlinked themselves, they joined other service projects. So it's kind of like it's an evolving chain, and that was very inspiring to me. You can just come. You may not be the strongest link in the chain, but you can come, you can do your part, and then when you're done with your part, you can leave and you can join another chain. And just seeing how some links come, some links go, just to see how that chain evolves, that was very inspiring to me. And the whole idea behind this was, let's get our seniors signed up as fast as we can for their safety, for the community's safety, for everyone's well-being. That was the intention. And it was just one of those things where it just happened very organically. I heard about this whole term Vaccination Angels afterwards. I hadn't heard about it before I started or before when we were doing it or anything like that. And it was just one of those things where Swami was putting us in the necessary place at the necessary time with the necessary knowledge to be able to help with what was the need at that time. So that's where my inspiration came from. Saidam.
Thank you very much, Sister Supriya. Now, could you please play the video of our young adult Dhara?
Sairam, the audio is not coming.
My involvement with the Vaccination Angels program.
Audio not working.
Still the audio is not working? Is the audio still working?
I can hear it, but it's faint.
Okay, we'll try one more time. Sorry about that. Shiva, I think there were some audio issues when I was doing it, so do you mind trying to screen share from yours?
Moved away for college, but I stayed in touch with the local center there as well. So I'm here to talk about my involvement with the Vaccination Angels program. And I was initially introduced to it by Brother Shiva, who I had not met in person, but who was given my number by a fellow Sai devotee. And essentially, Brother Shiva was asking for some help in securing appointments for some Sai Center families, more specifically Sai Center elders. So I had already been working with my aunt to help vaccinate elders in the general population, especially in the local population. And I thought this would be something that I could help do, and in doing so, give back to Sai Center as well. So I said yes, and it was really a great experience. So essentially, the way I went about it was I used this vaccination group on Facebook called DFW Vaccine Finder. And the main purpose of this group, which started at 30 people and now has about 20,000 members or so, the main purpose of it was to help people get connected to vaccines. So I essentially took names and information from Brother Srinivas and looked for different appointments that would satisfy the different unique requirements for each family. So I'll give you an example. There was a Sai Center family that needed vaccinations closer to home because of some driving restrictions. And I thought, okay, this might be a little bit harder because the demand in the Allen, Plano, Briscoe area is much higher than the demand in more rural areas. But I thought to myself, okay, if I just put in some weeks and some really intense effort, I think I can do this. So it did take me about, I want to say 2 weeks to get this family vaccinated, or rather scheduled for their vaccinations, just because the emails would come out to sign up vaccinations and they would go like that. They would go within a minute, sometimes 2 minutes, sometimes it couldn't even be a minute before all the appointments were taken. So at first, this really frustrated me. I'm not someone who has a great deal of patience. But I just reminded myself that things like this take time. Everyone's trying to get vaccinated. It's hard. And these, software programs weren't necessarily designed to take this great influx of people to these websites. So I just reminded myself, okay, Dhara, it's okay. Try again tomorrow. Try again the day after that. And try again the day after that. And I did. So that's my story. To this day, I'm still working with other families who need my help. It's getting much easier in the Dallas-Fort Worth area because there are more and more vaccines available everywhere. But it's brought me a lot of joy and a lot of satisfaction in helping people who aren't necessarily tech savvy get appointments when they really need them. So that's me. Thank you, and Sairam.
Sairam. Now, I would request this question to open to all the panelists. How did this specific service activity you have participated in inspire you to think about Swami?
I can talk about it briefly. Growing up when Swami would share his vision for either building the super specialty hospital or the water project or something, we would read about and get fascinated about how day and night thousands and thousands of devotees would come together and work and make that vision a reality. And so many millions of people will get benefited by it. And growing up in India, even people who are not Sai devotees will always know the Sai organization through the Seva Dal, who would come to all these other big gatherings to help keep the order and do service with their impeccable white clothes, with the scarf and so on, with very polite hands folded, very nicely they would take care of all the activities. So here you live in the US and you usually go with your small Sai center and do service projects in your little community. And Swami gave all of us in our little communities then this great opportunity, which touches thousands and thousands of people around the country, because this pandemic is worldwide. The need was the same, no matter whether it was a rich part of town, inner city, wherever it was. And so it was like Swami told all of us, here, I have this great need and I want all of you to get to business, start doing this for my mission. And so that's how I felt, that all of us came together so quickly. And yes, along the way, there were many things that were unknown, guidelines needed to be put, some problems happened, and then we needed solutions, be it lack of material availability or, whatever else it was. Swami gave the solutions right then and there too. So his work could go on continuously and very timely, like Supriya was saying. Help given in a time of need is just precious. It's just Swami's hands that guided us. That's what I felt.
Well, Sairam Shiva, if I can also share how it inspired me to think about Swami. So I remember after helping one person, I got a text back from them, and it basically said, "Oh, hon, you're such an angel." And I read that, and I felt very uncomfortable because I'd never been called an angel before. And I just felt I didn't do anything big. I just, helped register them. But then the more I thought about it, I realized that if I had been in their position, if I had been very desperate for something and somebody helped me with it, I too would have felt that, wow, this person wasn't like an angel who helped me in my time of need. And so I kind of turned around and it made me think of Swami, because I was thinking, oh, Swami, you're such an angel. You connected me to this person who needed something, and you you gave me the tools that I needed to be able to help this person. And so, I always kept channeling that towards Swami. If someone said thank you to me, I would say, well, it was you, Swami, who put me in that situation to be able to do what you needed me to do. So that was one thing. And then the second thing was, it made me also think about what Swami says about unity and community, like Vijayashree was saying, that when we, when we kind of move outside our comfortable circle and we get to know our neighbors, we get to know other people in our community beyond our comfort zone, when we create that kind of bond, we realize that there's a lot to us that's in common. And when a situation like this arises, at that time, already having that established like community bonds and stuff like that, you can just very easily reach out, and then you're a known quantity. So if I'm offering my help and somebody else is like, who are you? It's much harder to be able to do what you would like to do at that time. So the importance of kind of laying that groundwork beforehand, just getting to know people in your community. At a time like this, I really saw how impactful that was. And so, again, that made me think of Swami and his message of unity and how important that is to think about that all the time, not just when we're in a pandemic, but even when we're not in a pandemic. So I wanted to share those 2 points. Thank you, Saidam.
Points. Thank you.
Sairam.
Yeah.
Sairam, I can go. Okay. So we all know that Swami is the one who is the doer. Without him, even a blade of grass doesn't move. So when I started working with the pandemic, I wanted to remember one quote which Swami says, life is a game, play it. So the rules of the game changes according to the need of the hour and our own spiritual journey. So recognizing that need and to be there and to be ever ready to take on the task without questioning, without my monkey mind driving me. So, and always to remember that Swami is holding the string for this divine play. Thank you.
Yeah, thank you, sister. I think the next question also is to you. Would like you to speak about COVID-related precautions.
Okay, the precautions kind of are the same. Most of it is the same, like wearing the masks, washing your hands, disinfecting the surfaces, staying 6 feet apart, and especially when you have people visiting you, and people can be without any symptoms, they can be carriers. So always make sure you have the distance and wipe the surfaces clean, and try to avoid the gatherings, huge gatherings, as much as we can. Small gatherings are okay if everybody is vaccinated. And other precautions, especially now people are traveling, and make sure, especially international travelers, see the CDC guidelines for every country and their requirements. And the domestic travelers, it's the same thing, wear the mask, wipe things down, and be as safe as we can and with our good judgment. That's about it.
Thank you, sister. So I would like to thank all the panelists for their time and effort. I think they have made a positive inspiration to me. I hope they might made some similar inspiration to you as well. I would now request our regional vice president, Brother Mahesh Rege, to speak.
Loving Sairam to you all. First and foremost, I would like to humbly thank our most beloved Lord, Bhagwan Sri Satya Sai Baba, for the opportunity to be of service to our communities in some of the most trying and testing times for humanity. Next, I would like to acknowledge the tremendous time and work that our volunteers have put in to lovingly lead the mask making, distribution, and several other services during this pandemic. As our panelists have shared, many of us did not have the ability to make these masks when we embarked on this project. But as Swami always says, if you show the availability, I will give you the ability. Our volunteers were able to develop a strategy to make the masks and other personal protection equipment within a week from idea generation to production. Not only that, they were able to share best practices amongst themselves, lower production costs consistently, and scale up the production efficiently in multiple cities within our region. In all, more than 120 volunteers from our region were involved in the procurement of raw materials, cutting of fabric, sewing, transportation of supplies, and finished goods. As you have seen, we have received many thank you cards, notes, and recognition from our community partners for this loving service. More than 17,000 face masks, 6,000 disposable masks were made and distributed to over 15 healthcare centers in 5 states. Additionally, we distributed face shields, KN95 masks, hand sanitizers, gowns, scrub caps, and other PPE. Our region had the highest production and distribution of these items amongst all the other regions in the United States. In trying times for all of us during the pandemic, our Sai volunteers found other novel ways to serve the communities, as shared this evening by our panelists. Vaccination Angels and food distribution to needy communities being 2 shining examples. Sai centers in our region, both large and small, work together in love and unity to ensure that we were able to create a positive impact by fulfilling dire needs in our communities. These selfless service activities are perhaps the single most efficient and universal tool for understanding, experiencing, and expressing the divine principle of Swami's love. As Swami has said, service to man is service to God. Our panelists today have helped reinforce what Swami has repeatedly reminded us, that all service should be regarded as an offering to God, and every opportunity to serve should be welcomed as a gift from God. My humble gratitude to each of our panelists this evening for lovingly and eloquently communicating these very inspiring service activities. Our next Inspiration Channel session will take place on the 5th of May. The topic we will cover during the next session is Go Green service activities within our region. Please do join us for this energetic session in 3 weeks. I hope you all have a blessed evening. Jai Sai Ram.
Sai Ram.
Thank you, Sai Ram. I think so, yeah.
Thank you, Sai Ram.
Sai Ram.
Sai Ram, everyone. Thank you. That was a lot of fun.
Yeah, I enjoyed the opportunity to do it. Thank you.
Yeah.
Thank you so
Sai
much.
Ram.
Sai Ram.